Welcome to this training video on how to use Parafricta undergarments. All these products are intended to aid in the prevention and healing of pressure ulcers, either alone or in combination with pressure-relieving products. They can also be worn over wound dressings. There are 3 different models of undergarment, which are all washable and reusable. The undergarments may be for you, your patients, or a person you are caring for. If you're trying them for yourself, we advise you to inform your main health or care professional when you next see them.
The slip-on models, the brief and boxer, are suitable for wearers able to pull up their underwear. The front opening brief can be opened at the front, and bed-bound users can slide safely into the undergarment before securing it.
It is important to remember that pressure ulcers, sometimes called pressure injuries, more commonly called bedsores, can lead to very serious, even life-threatening health consequences if left untreated. If you or anybody in your care has a pressure ulcer, we strongly advise that you seek the advice of a qualified healthcare professional.
The undergarments of all styles are designed for continuous wear under clothes or nightwear in place of regular underwear. Their aim is primarily to protect any part of the trunk exposed to friction and associated shear by voluntary or involuntary movement of the skin over the support surface. Having chosen which style of undergarment to use, the next step is to choose the correct size for the user. You can do that by measuring the waist and hip size and then consulting the size selection tables, which you will find in our user guides available online. It is important to select the size that will fit over the hips, if in any doubt, and for the undergarment not to be too tight-fitting. Be aware that the sizes are not the same for the 3 different styles. For example, someone who is comfortable in a medium slip-on boxer will find the medium brief styles too small. As a rule, men who wear medium underpants from major retailers will find that the medium boxers fit. Similarly, women who wear medium underwear from major retailers will find that the medium slip-on briefs fit. Taking the 2 measurements is the best way of being sure to get a good fit. The boxer style is generally preferred by male patients and the slip-on brief style by female patients. The front opening style undergarment is suitable for all patients and comes in sizes up to 3XL, but the most important factor is patient choice and comfort. To put the undergarments on, firstly, release all the straps. Lay the undergarment out flat on the bed and slide the patient onto the undergarment. The technique for doing this should be familiar to most nurses and carers who are trained in moving and handling techniques, similar to that employed for getting someone into a sling without them leaving the bed. You can then secure the undergarment with the hook and loop tabs. In all cases, it's important that the vulnerable or affected skin is in contact with the low-friction lining of the undergarment. For the undergarments to be most effective, the patient should not wear their normal underwear underneath or anything that comes between the skin and the low-friction fabric. Incontinence pads can be worn inside the undergarments, although they may need to be kept in place with a net under the undergarment. The front opening undergarment can be adjusted, and therefore it may be easier to secure a pad using this style. Patients wearing an adult wraparound between the affected skin and the undergarment are likely to experience less benefit. If the patient is using a catheter, it can be inserted through the fly of the boxer or between the fastenings of the front opening undergarments. In all cases, as well as preventing and being used to treat pressure ulcers, the undergarments may simply be used to help retain wound dressings, which tend to get rucked up and displaced by the action of friction and shear. If an undergarment becomes soiled, or clinical judgment is that they are no longer clean enough to wear, it should be washed and replaced.
There are 2 important precautions to highlight. One is that Parafricta undergarments should never be worn directly over an undressed open wound or pressure ulcer. They are suitable for wearing over a dressed wound.
A further precaution is that whilst undergarments are ideal for Category 1 pressure ulcers, which are characterized by non-blanching, erythema, heat, edema, and other changes in skin condition, they should not be employed alone if there's suspected deep tissue injury. Most healthcare professionals know that a suspected deep tissue injury will present with a dark purple color and other changes to the appearance of the skin. It is a condition that should also be treated by minimizing the pressure using a pressure redistributing mattress and by a repositioning routine according to the guidelines. The undergarments may be used in combination with pressure-relieving interventions, particularly where repositioning is exposing skin to friction and shear. The way that Parafricta works is by providing relief from friction and the shear associated with it. The ideal time to use the undergarment is preventatively in situations where the buttocks, particularly beneath the ischial tuberosities and other areas of the trunk, are exposed to high levels of friction and associated shear, and before the skin begins to break down completely. For example, 1. People who repeatedly slide down the bed, chair or wheelchair, leading to non-blanching erythema, heat, edema, or other early signs of a pressure ulcer. 2. People that unavoidably drag the skin on the support surface when using a transfer board to move from bed to chair. 3. Patients with neurological conditions who are very agitated and shuffle on their buttocks. 4. People who have spinal injuries that make it difficult to feel when to reposition, and any discomfort which is a sign of the onset of pressure ulcers. Whilst prevention is ideal, the undergarments can be used on Category 1 pressure ulcers, and they can be used when advised by a healthcare professional on Category 2 pressure ulcers which have been dressed. We also advise pressure redistributing cushions and mattresses, and a frequent repositioning routine for any Category 2 plus pressure ulcer or suspected deep tissue injury. However, it may well benefit the patient also to wear the undergarments to limit exposure of the affected area to friction and shear. The undergarments can be washed, ideally in a light load at 60 degrees on a synthetic setting in a domestic washing machine. Hospital laundries and commercial laundries often have a special setting called a sanitizing cycle, which will go up to 70 degrees for up to 10 minutes. They can be tumble-dried or simply line-dried. Sometimes the undergarments may be soiled in a manner which is just not removed by normal detergent. A proprietary oxidizing stain remover will help to remove those stains. You can even pre-soak them, but never use domestic or chlorine-based bleaching agents. The undergarments should not be ironed or dry cleaned.
In summary, 1. Remember that pressure ulcers are a serious condition and should always be addressed by a healthcare professional. 2. Consider the most suitable style of undergarment for the user, depending on their physiology and ability to put on their own underwear. 3. Measure the waist and hip dimensions of the user. Choose the most suitable size of undergarment, bearing in mind that the sizes are different for each of the 3 styles. 4. Never place the undergarments directly over an open ulcer or wound. 5. Change or replace the undergarments when they become soiled. 6. Consider using the undergarments in combination with pressure-reducing strategies, such as frequent repositioning or pressure-redistributing cushions and mattresses. 7. Follow the washing instructions on the care label and instructions for use.
If you need more information on how to obtain undergarments for you, your patients, or people in your care, please check out our website, parafricta.com. You can email us at info@parafricta.com or call 018-6922-6566. Other information on how to use the undergarments is in our user guides, which are available online.